just to kick the conversation off, I can tell you what I think are the biggest problems in the healthcare system, but as the moderator, I'm going to be unbiased and going to work to facilitate this conversation. So let's throw it out to the group. Who wants to start? Biggest problems in the healthcare system, as you see them.
I'll go ahead and just jump in. I think it's access. That if you don't have insurance and you can't get insurance, then you are just out of luck. And it's, I've been fortunate, I've always had good insurance, but I know people don't. And the rate of deterioration in conditions that could be easily treated, I'm thinking of a friend of mine with high blood pressure, can easily be treated. I'm really worried that the guy's going to be dead at the end of the year because he's not taking control of it. And it's so out of control that I'm not sure he can do it without medication. That he can't afford the medication or the doctor gives him because he doesn't have insurance. And that's probably the number one issue.
Okay. Well, it sounds like that there may be even two things tied up in there. One being the access piece, but also the affordability of cost piece.
Right. Yeah, you're right.
I would echo that I feel the same thing, that access to care and the disparity that we have in the access to care depending on what state you were in. I am a breast cancer survivor, and I know going through the process of the treatments, I had excellent healthcare coverage, and it's the individual that you see that doesn't have that same experience that brings the passion to me for why I do what I do. I just can't imagine being diagnosed and have to worry about how you're going to be treated and get the care.
I think it creates a cascade effect that people who don't have insurance then resort to emergency rooms and things like that because it's really their only option, their only way, and that puts further stresses on the healthcare system when you're providing what could have been prevented or providing care to an emergency room setting.
I think, well, I just think, I think reimbursement levels and the loss of providers because, I think there should be some sort of incentives for folks to take Medicaid in order, the eligibility of what, and the, eligibility for people, just ensuring, because in the past couple of years since we've gone across the country with our community challenge, the stories you hear about the folks that are falling through the gaps are sickening, and it shouldn't be happening in our country.
Unfortunately, as more providers are wanting to opt out of Medicare and Medicaid, then that just leaves people with those Medicare and Medicaid beneficiaries with less options and where they can go.
So related to the access problem is prevention and screening. If we don't have access to the system, you don't adequately do the prevention measures, you're not doing screening because it's expensive to pay for it by yourself. And that's a huge suck on our, when people enter the system after their diseases progress, it's a huge suck on the financial and worse, it is a loss of life that would not need to be.
We're sitting around this table, we've got a job, we've got insurance. The next set of layoffs come, we don't have jobs, we don't have insurance. It's not a very thick net.
And employers are also cutting back on the benefits that they're offering because the premiums are so expensive.
And doesn't that get into, I think, one of the other issues that we talked about in access? One of the reasons why we have a problem with access is that there's a lack of portability, that we've become so reliant on getting our health insurance through our employer. We're very fortunate here that we've got a great health plan, but if I lose my job tomorrow, that health plan goes out the window and I'm stuck trying to find it on the individual market or find another employer that has another health plan, and it may not be as rich as this one. I may have to find a new provider. It comes into a whole another set of issues of the fact that I'm tied to the health plan because of who my employer is.
And it affects people's decisions about their jobs and starting businesses. My dad's always owned his own business, and my mom's sort of been tied to a job that's maybe not her ideal job, but because the benefits are good and she has retiree benefits, so she's fortunate. But it probably wouldn't be her ideal, but in order for him to be self-employed, she had to maintain good insurance.
I think too is that we probably need to also, in the scheme of things, consider the underserved, the underinsured, and who those people are they're working for, and how they're not uninsured, and they're out there doing their part within the community, and what is their access, what is their quality of care.
Sure, and that's a good point too, is the quality piece. Because the question when you're talking about access is access to what?
And I think if we can make it just simpler to provide care, what the options are, then I think that's the biggest problem I see.
I'll echo on that too, just from coming from the helpline and talking to all the patients that call in. That is very key too, to keeping it simple, because when you're diagnosed, I mean, you're pretty much numb and you take care of your family before yourself. And so a lot of these women and men that are facing these diseases are just overwhelmed with, like you said, the amount of paperwork, the confusion, what do I have access to, what can I get help with. So I think that's just another piece of all of this too, is just the navigation of the system.
And it's so fragmented with all the
Yeah,
different
it is.
providers that you have to go to just for one condition.
Yeah, you see that. I mean, the healthcare system really is kind of made up by a bunch of kind of balkanized pieces that don't really work very well together, especially when you're transitioning from one to the other. Like if you're working for an employer that offers a really good healthcare plan, you lose that job, then you leave that piece or that plate, you have to move to a new plate, and the two don't really correspond and talk to each other very well. So definitely, I think the complexity is a huge issue. Any other thought?
We haven't talked about research. If you look at the levels of investment in research the last couple of years from the government, it's dwindling, and thank goodness Coleman is there to pick up some of the gap. But the question in my mind is, if we increased the investment in research, then would we expedite the cure so that our need for access to care would be less?
Yeah, well, that definitely plays into it.
And I think it plays into the access to clinical trials and getting people into clinical trials and just ensuring that, again, we're expediting what is out there and getting people what they need.
Absolutely.
And this might be looking into the future a little, but I don't think very far. In terms of one of the biggest problems facing the healthcare system is our economy. I mean, I really don't know how much is going to be on the table to reform in terms of changing things. Budget offices come out with reports, it seems like every week now, saying there ain't going to be money to insure everything.
Well, it goes beyond that. We were talking about how thin the safety net is. We have more than half the states find themselves in state budget crises. They're having to scale back and try to close those budget gaps. And we see in communities all over the country where healthcare programs, the Medicaid programs, are being reduced to reimbursement rates, and they're even there's a downward pressure from the state budgets where they're trying to put more off on to the healthcare network themselves, the hospitals and others, and then their budgets are out of whack, and they're having to find places where they can make cuts, and ultimately it's the patient that suffers.